A new approach is needed to support individuals in mental health crises, focusing on care over confrontation. By Darius Spearman, African Elements. Support African Elements at patreon.com/AfricanElements and listen to recent news in a single playlist. Additionally, you can get early access to ad-free video content. Fatal shooting of autistic teen sparks debate on police response to mental health crises. The recent fatal shooting of Ryan Gaynor, a 15-year-old autistic boy, by a San Bernardino County Sheriff's deputy has ignited discussions. Consequently, there is now a heightened focus on law enforcement's handling of mental health issues. The incident occurred after Ryan's parents called the police to help manage a domestic disturbance. Instead of de-escalation, the encounter led to Ryan's death. As a result, it raises questions about the use of force against individuals with mental health challenges. Shifting the focus to alternatives. The tragic outcomes of police interventions in mental health crises underscore the urgent need for alternative approaches. Spotlighting the necessity for compassionate, non-police responses to individuals in distress. The autistic community has seen far too many cases of law enforcement profiling, targeting, and using excessive, sometimes deadly force on Black autistic people, said Zoe Gross, advocacy director at the Autistic Self-Advocacy Network, Los Angeles Times. This call for change emphasizes the broader movement towards crisis intervention alternatives, aiming to ensure safety and support for those experiencing mental health challenges. Community-based support systems. The community's response to incidents involving mental health crises highlights a collective demand for supportive, non-coercive interventions. This approach aligns with the concept of a strengthened social safety net for mental health, aiming to create a more empathetic and effective response to mental health crises. The importance of transparency and accountability. In the quest for alternatives, transparency about current response strategies and accountability for past actions are critical. The call for the release of body camera footage reflects a broader demand for openness and a re-evaluation of public safety strategies. Thus, it fosters a culture of accountability and trust between the community and those tasked with crisis intervention. Investing in mental health infrastructure. Building a robust mental health infrastructure requires significant investment in resources, training, and community services. Advocates envision a future where resources are readily available for those in need, with a focus on preventive care and early intervention. Expanding access to mental health care and support services can transform how society addresses mental health crises. Thus, it moves away from punitive responses towards healing and recovery, towards a new paradigm of crisis intervention. The journey towards reimagining crisis intervention is complex but essential. It involves redefining public safety to include mental health as a core component. Consequently, community-based support systems play a pivotal role. By investing in mental health resources and fostering partnerships between mental health professionals and communities, a more compassionate approach is possible. Moreover, this approach is more effective in supporting individuals in crisis. Mental health and law enforcement training. Research indicates that police interactions with African Americans can lead to stress and mental health issues. To mitigate these effects, there is a call for improved police training and accountability structures. Community-based restorative justice approaches are also suggested as part of systemic changes. To mitigate these public health consequences, it is imperative to conduct screenings and refer people who experience police mistreatment and abuse to mental health services. From a study on the effect of police training and accountability on mental health, PubMed. Alternatives to police response. Alternatives to traditional law enforcement responses for mental health crises include dispatching specialized EMTs and funding community services. These alternatives aim to provide support before situations escalate to the point of requiring police intervention. We must fund and implement alternatives to policing, Gross stated, highlighting the need for different types of first responders for people in crisis, Los Angeles Times. The role of mental health services in police reform. Mental health services and professionals play a crucial role in the ongoing efforts to reform police practices. Their involvement is pivotal in addressing the urgent mental health needs and crisis response within communities. Particularly, this is crucial for those disproportionately affected by policing practices. Mental health professionals and police reform. Needs and crisis response need a new focus. Experts want to limit law enforcement's role in handling mental, behavioral, and social issues, especially in communities of color. This change is vital. Sadly, police involved in mental health crises often lead to harm or even death. The reliance on police started in the 1960s with deinstitutionalization. Yet, there wasn't enough investment in community support. Many lack treatment access, increasing risks for behaviors seen as criminal. Often, people needing urgent mental care must dial 911. Police respond, even if there is no safety or crime issue. Accordingly, there's been a shift towards more military-like law enforcement. The use of force has gone up. This impacts communities of color the most. Mental health experts suggest new ways to handle crises. Furthermore, they stress the need for alternatives that don't involve police. It's important to meet the behavioral health and social needs of those with mental illnesses, psychiatry online. Crisis Intervention Team and Corresponder Models. The Crisis Intervention Team (CIT) model is a collaborative approach that has gained attention for its potential to improve police responses to mental health issues. It is based on partnerships among law enforcement, the mental health system, and advocates. This model aims to provide a more compassionate and effective response to individuals experiencing a mental health crisis. Consequently, it reduces the likelihood of arrest and increases the chances of connecting individuals with appropriate care. However, the effectiveness of CIT and corresponder models depends on comprehensive training and community-based mental health services. Additionally, a shift in policing culture towards a more empathetic and informed approach to mental health crises is required. USA Today. Innovative solutions and community-based approaches. Innovative solutions to the mental health crisis, such as shifting away from police as first responders, are being explored and implemented in various jurisdictions. Alternatively, these approaches involve mental health professionals de-escalating situations with trained police protection and support, suggesting a significant modification in the role of police when mental illness may be involved. Sadly, recent incidents underscore the risks of relying on police to resolve incidents involving people experiencing crises, highlighting the need for a comprehensive and adequately funded mental health service system in the United States. Brookings. In summary, mental health services and professionals are integral to police reform efforts, advocating for a reduced role of law enforcement in mental health crises. Additionally, they advocate for the development of alternative, community-based response models. These efforts aim to ensure that individuals experiencing mental health crises receive compassionate, appropriate care while reducing the likelihood of tragic outcomes. Racism's role in police responses to disabilities and mental health. Racism can affect how police respond to people with disabilities and mental health issues. Clearly, this is a big problem for Black people with disabilities. They face both racism and ableism. Ableism is unfair treatment of people with disabilities. Police often do not understand disabilities. Therefore, they are prone to too much force. Consequently, they can hurt or even kill Black people with disabilities. Challenges at the intersection of race and disability. Black disabled individuals frequently encounter a dual set of prejudices from law enforcement, racism, and ableism. Likewise, a significant portion of Black individuals who have been killed by police were living with disabilities, highlighting a critical issue within police responses. Unfortunately, officers often lack the necessary training to appropriately assist those with disabilities, which can escalate into violent encounters. The violence Powell experienced is a product of both racism and ableism. Urban Institute. A distressing example of this is Gilberto Powell, a Black man with Down syndrome, who was beaten by police under the mistaken belief he was armed. In fact, the actual object in question was his colostomy bag, not a weapon. Thus, the incident underscores the severe impact that both racism and ableism can have on Black disabled people, demonstrating the urgent need for systemic change. How to support Black disabled individuals. Supporting Black disabled people involves diversifying the responders to mental health crises. Additionally, by involving a range of professionals beyond law enforcement, such as mental health experts and community care providers, we can ensure a safer environment. Furthermore, this approach not only enhances the safety of Black disabled individuals, but also fosters a community-based support system tailored to their needs. Tackling the compounded harms of systemic racism and ableism in the criminal legal system requires centering the needs of Black disabled people. Urban Institute. Sadly, the combination of racism and ableism can make it dangerous for Black people with disabilities when they meet police. Building a compassionate future. In conclusion, the tragic death of Ryan Gaynor underscores the urgent need for reform in how police respond to mental health emergencies. Further, it calls for a shift towards more compassionate, trained, and appropriate responses that prioritize the well-being of individuals with mental health conditions. The call for a transformative approach in addressing mental health crises is clear. Advocates are united in their belief that communities of color need safer, more compassionate responses. Instead of relying on law enforcement, the focus should shift towards community-based solutions. These solutions prioritize mental health and social well-being over punitive measures. By embracing alternatives, we can protect vulnerable individuals and foster a more inclusive society. This vision for the future holds promise for creating environments where everyone receives the support they need with dignity and respect. About the author, Darius Spearman is a professor of Black Studies at San Diego City College. There, he has been pursuing his love of teaching since 2007. He is the author of several books, including Between the Color Lines, A History of African Americans on the California Frontier through 1890. You can visit Darius online at africanelements.org.